Well, thank you all for having me. I really want to make this interactive. So if you get to something, you have a question or you want to have a comment, I am happy to, surrender the floor to you guys. And again, because I learn as much from the parents that I work with at Scottish Rite Hospital and in the community as I ever learned in book learning or just webinar seminars. It's all more parent driven. So at any rate, so what I want to talk about tonight is nutrition and children.
Give me 2 seconds, this thing keeps dying. I'm so sorry.
Oh, okay, sure.
What can I get you? I'm going to see if these batteries are going to work. This thing always dies. I don't know why. Okay. Thank you.
Okay. All righty. So about children on the autism spectrum. So I like this quote and I like the picture. But so we talk about kids and autism or developmental disorders, and sometimes we say we don't connect or can't connect. And so I found this quote. It says, "Attention is the thread that holds together the fabric of our consciousness." So we know that our children with autism live a little bit in a different world than us. So, but we want to connect and we want to be there, and part of connecting is feeding. So that's where my specialty is, looking at nutrition needs and then looking at feeding strategies. So in your handout, I was confessing to Pamela when I came in, I like this picture. This is my favorite picture of the brain and the gears and all that. So in your handout, there's a definition that it's a different definition. It's really, this is a more specialized definition, but your handout is wrong. And I realized that this morning as I was going through my notes, getting prepared before I went to work this morning. But so autism, just so that we kind of are sitting in the same space, refers to a broad range of conditions characterized by challenges, of course, with social skills, repetitive behaviors, speech, and nonverbal communication. So that kind of goes back to that attention to our entire lives. So just as kind of a review and where I'm coming from, the 3 types of autism, there's autistic disorder. And I'm sure your pediatricians have discussed this, maybe the school personnel have kind of helped you come around to a diagnosis. So classic autism is what you kind of think of when you have that, again, those repetitive behaviors, maybe that inability to meet your eye gaze, that desire for structure and order. And then again, 10 years ago, there was autism, there was Asperger's, and then there was pervasive developmental disorder. And then they redefined things, and within the developmental medicine community, they said there are kids that sit right in between there, so we're going to call it all autism spectrum. Now, the people with Asperger's hated that. They didn't want to be lumped with anyone, but that's a hallmark of Asperger's, is that highly structured way of thinking, that high ability to organize things and to think differently than the rest of us. So let me see, I had to give you the quick, something else I wanted to say on that. So Asperger's, again, they have social challenges, again, relating to being on the spectrum, not wanting to be there. I have a friend with Asperger's. He was highly offended, and I think to this day doesn't accept that there's a spectrum. But I love him anyway. Kids with autism, classic autism, have more of those speech disorders, and by virtue of that, sometimes have some oral motor coordination problems that limit their feeding ability or change their feeding ability. Whereas you move farther along, Asperger's, the oral motor skills tend to be fine. There's not an issue there. But the types of food, the setting for food, the spices used, they're highly sensitive. And so that when I'm working with a child with Asperger's, sometimes we have to work with their structure to bring them back to how we eat in the real world, how we eat at home, how we eat at school, how you eat at college, because it's different. So, and then I think this is the diagnosis that parents hate, or been my experience, when they have a diagnosis of pervasive developmental disorder. You know, as much as we don't want to know that our child has something seriously wrong, we want a diagnosis. We want something, a pervasive developmental disorder, not otherwise specified. What does that mean? So many of the moms are like furious at getting that, but it just says there's things, maybe there's genetic problems, there's some neurological differences, some seizure disorders, but we can't put it in a box, and we like to put things in boxes. So this is, I want to talk a little bit about going through the system here. I will say on the PDD, NOS, so again, there's a little more oral motor issues sometimes there, and sometimes some behavioral challenges that I see more there than in the regular autism spectrum. So what do we know about the etiology of autism? Let's see. Okay, there we go. So from my study, from my reading and my training, we don't know exactly. We don't, I mean, that's not something. So there's some ideas that there's some genetic things, and something called a candidate gene, which they've identified as being common in maybe about 30% of people with autism, but they can't lock it in entirely. Then lots of people say it's environmental. So what was I exposed to prenatally? Was I exposed to heavy metals? Was I exposed to organophosphate pesticides, not Roundup, but others? You know, everybody wants to talk about Roundup, but Roundup is not an organophosphate. And then, so sometimes it's fumes, it's paint, we worry about everything. So then you think, okay, is it nutritional? And that's really where I've done a lot of studying and looking at. So one of the things that's come up and had a lot of interest, and they're still doing some replication studies, but vitamin D. Now, you know, vitamin D is responsible for everything. Everybody's talking about their need for vitamin D, everything from joint pain to foggy brain to everything. But there was a relationship to vitamin D levels during pregnancy and the development of autism. But again, because it's a big spectrum, there's lots of things along the line. But nonetheless, we do think that it's beneficial for moms for lots of reasons during their pregnancy to have adequate amounts of vitamin D. So let's get specific here and talk about the nutrition problems in autism spectrum. Why I keep getting extra things? Oh, I know, I got to think here. So appetite changes related to medications. Excuse me, I have a scratchy throat. So what are we thinking about? So we can think about the ones that cause you not to have an appetite. Some kids on the spectrum, just like kids with ADHD, will be put on methylphenidate. So Ritalin and Strattera and Concerta and gosh, what are all the Focalin, the newer ones. Excuse me. And they tank your appetite. They're just going to drop it out. And so you get a better behaved student that doesn't eat, or that doesn't eat until the evening. Have any of you seen that? Yeah. So so you have that. Now, on the other side, you have some of the medications for the behavioral related issues, like Risperdal is a pretty big antipsychotic, works well for behavior management. But I can tell you from working with kids at Scottish Rite that the Risperdal kind of just automatically grants you a 15-pound weight gain. And then it's, so it's something not to be played with lightly. And again, talk to your physician to say, okay, maybe I don't want to do this. But if it's necessary, then just know that we need to work a little harder on their nutrition. So the impulsivity, you know, there are kids with autism that are runners, and that's part of that impulsivity, or they are the ones that might, instead of not eating, they might sit down with a box of cookies, and then even though they say they're only going to eat one, then the next thing you know, the entire box is gone. But it's that little bit of that lack of being able to think past the immediate right there. So then obesity, and we're going to talk a little more about obesity as we keep on working through here. But kids with autism are 1.5 times to 1.75 times more likely to become obese in early childhood and remain obese during adulthood. So, and again, I think that kind of comes back, not necessarily to the activity, because typically we have some pretty good activity going, but it's the eating styles and the types of food. It's the desire for eating environment. If it's pleasurable and you eat, then you have to work on not giving too many calories. But it is something that as they get to be adults, if they're overweight, they have the same cardiovascular, the same diabetes risk that all of us have. And that's not something that you wish on your child as they grow up. So we want to watch for the obesity. But on the other hand, just like we have an autism spectrum, we have this underweight, and then we have the overweight. The underweight a lot of times will come from that set line of food that I'm going to eat in the set environment, and then getting enough calories in them, as we were just visiting about, getting enough calories and a well-balanced diet is pretty tough to do sometimes. So sometimes what you see with medications and then the underweight is that growth delay. So you go to the doctor, and where he used to sit on the little growth chart that the nurse shows you right at the 10th or the 25th percentile, and all of a sudden for a whole year you're stuck at that 25th percentile, and that lack of normal growth sets you back over at the 5th or the 10th or below the 5th percentile in terms of that linear growth. So I will tell you just a little trick that I teach my dietetic students is that calories drive weight gain, but protein drives linear growth. So if you have, over the course of your growing child's life, and particularly that mid-childhood, if you're not getting enough protein and you're getting enough calories, so you'll still have that weight gain, but you'll see them kind of sliding off the growth curves. You know, dietitians, we love our growth charts. We like to plot people on our growth charts. But looking at that and watching that height slide off, I might ask you questions about what is their protein intake like? What are their vitamin and mineral intakes like? And looking at that. And so if I see that sliding off, then I may start talking to you about ways we can boost protein intake and then keep our calorie intake still at the same level. So I always consider protein as our kind of a rocket ship of growth, and the calories are the boosters. We're going to get that up there. So we don't want to use protein as the source of calories. Like, we don't put kids on a high protein diet, but we do want to get them adequate amounts of protein to kind of counterbalance that. Now, I will tell you, sometimes on the medication, either the ADHD meds or even the Respirodol, you're going to see this drop. When you start it, I just can guarantee you're going to see this drop in their linear growth. But then that seems to gradually, if you could keep that nutrition going, then gradually you see some improvement there over time. So if you go and you take out your little kid's growth chart and you look and say, oh, no, he's going to be really short. Well, just know that you can work past that. But I just have noticed that over time that there's that lag, and hopefully we can catch it back up. So now again, let's talk about nutrient deficiencies. So if we're looking at kids with autism that are eating the 7 white foods, the pasta, the fries, the applesauce, sometimes scrambled eggs. I'm always happy when I hear scrambled eggs in a diet history, and maybe some milk, maybe some cheese. It's almost always white. And maybe chicken nuggets. They're not white, but they're close. But I think I'm going to write a book someday, and I'm going to call it the 7 white foods, because lots of kids get stuck on that. Similar textures, similar colors, maybe similar smell, something about that. But then, as a dietitian, I'm looking at what are we missing. So if you think back to your days in, I used to call it home ec, but home life, what do they call home ec and home ec, they call home ec. So what do we know? Where do our vitamin and minerals come from? Vegetables, fruits and vegetables. And what color are fruits and vegetables? All colors, not white. Yeah, not white. So that's when you were talking about adequate nutrient intake, I will be asking questions, and you should be looking and saying, gosh, what color is this plate? And it's not that applesauce doesn't have some vitamins, it's not that potatoes don't have some vitamins. But if you're looking at B vitamins, that's whole grains, that's nuts and that's seeds and that's some types of meats, that sort of stuff. So you have to kind of look at that. And then, so that's you look at expanding when we start talking about food chaining, looking at expanding similar colors, expanding to include those vitamin foods. So we've already kind of covered medication side effects. There we go. We had decreased appetite, weight loss, nausea. Some of the medicines will give them nausea. Not bad, not so that every time you give them a pill they're throwing up, but it's that low level nausea that kind of says, oh, I'd do anything but eat. And stomach pain, a dry mouth, has a whole list. I didn't mean for this to fill it in like that. Didn't do it when I was at home. But then, so these are the nutrition ones, or things that can affect that. Like if they're nervous about eating or they're restless and they just do the drive-by on the table as they're running and playing, that impacts their ability to have adequate intake. But then, you think some of these others, and I just took these right off the list of the nutritional side effects of medicines. You get mood swings, so one day they're coming to breakfast and they're happy as a clam, then another day, nothing to do with any food. And if you're agitated and you're moody, the last thing you want to do is sit down to a table with your parents and your siblings and eat food for 20 minutes. So just know that those are there, and look at your meds. If you see a change in your child and you're struggling to kind of think what's happened and the environment hasn't changed as much, go back, look at the meds that they're on. Or a lot of kids are on multiple meds, something we call polypharmacy. So if they're on multiple medications, see if you can't get either your pharmacist or your physician to go back and look at everything and say, are these all necessary? Now, certainly, I'm not advocating for going drug-free because lots of kids need some medicines to kind of help them function. But at the same time, look at that and see if there isn't another version of that medicine, or whether there's maybe a change in dosages that will help you a little bit. So when we start talking about how are we going to treat, we're going to look at that pharmacy. We're going to look at what are those drug effects. Then we're going to look at behavior, and we're going to talk a little bit about behavior. These are the things that I can impact. I can't do anything about the pharmacy part, but I can help you look at behavioral aspects, environmental aspects, and the nutritional aspects. And so it's not just one thing. You're going to need to change lots of things and sort out which one provides you the improvement in your child's nutrition that you want. So we're going to talk a little bit about nutritional or behavioral things. And so one of the things people are always looking for are alternative treatments, right? You go to Whole Foods or you go to Sprouts and you kind of walk down that line. Or, even now, you just pull up Facebook and there's all this sort of stuff that this will provide relief and this will do this and this. Your child needs extra of my super duper Dr. Perlmutter's chocolate milk mix. Now that is one that I had a family come to me and they said, our friends highly recommend this protein or this chocolate milk mix, and it's going to fix his autism. And I said, well, I haven't heard of this one, so let me do some research. And that's my entertainment, as I look up stuff. So I took a picture of the label and I went back and I looked up the website, and it really turned out to be essentially Carnation Instant Breakfast powder in a chocolate mix with an extra B vitamin. I just broke it down and said, what can I relate this to? But it was $75 for a little can. So don't get taken with those. But at the same time, we do know there are some benefits. But if you read something, just always, if it seems great and it seems to be the solution that nobody else knows about, and it's being sold on a multi-level marketing basis, it's probably not worth it. It's too, I'm sorry, hope nobody sells that. But at any rate, because this Dr. Perlmutter is a neurologist. So I thought, well, maybe he knows something. There was nothing new. It was chocolate milk and a vitamin. So, but you know what? We want something to work. I want something to work. I would love nothing more than to find a nutrition combination that helps these kids eat and feel better and have good bowel movements. So dietary interventions, we think that there's some correlation between diet and symptoms. So meaning not the cause of the autism, but some of the things about the autism and the bowel movements. Some kids have terrible bowel movements, either really constipated or lots of diarrhea. And so we know that there's some symptoms there. And we do know, as I'll get kind of in my little list of things, that there are some things that help, some higher levels and some lower levels. So overall, I just have to say, kind of middle of my speech, my disclaimer here is that improving the quality of the child's nutrient intake, expanding beyond those 7 white foods, expanding beyond banquet chicken nuggets, and then working to eliminate extra things that we might not need. So at any rate, so then there's some, I'm going to go through this, but there's certain nutrients, some herbs, some traditional Chinese medicine, which I thought was really interesting as I started pulling together my research, looking at, there's some open studies currently at the Mayo Clinic and one at Johns Hopkins, looking at the use of a couple of different Chinese herbs that seem to be having some benefit. So at any rate, so now let's get to the meat and the practicality, not the theory. So what's challenging about feeding your kid? Don't you know? Everything. Food jags. Whose kid has ever gone through a food jag? Anybody? Nobody's ever?
Tell us what jag is.
Oh, okay. A food jag. Like, I'm only going to eat fish sticks, peas, and applesauce for months on end. Yes. So everybody, probably even us as children, went through this thing where this is all I'm going to eat. I tell stories about my 40-year-old daughter who now has her 3 own picky children. But when she was about 3.5, she went through this thing. The only thing she would eat is fish sticks, peas, and applesauce. So I felt lucky, and the pediatrician told me not to worry, but I was a little freaked. But he said, she'll get over it. She'll get over it. And now she will not eat peas, fish sticks, or applesauce. Not on her food list. But so you just think, I'm going to provide them with a good meal. And here they are, not eating that. Chaotic meal times. Again, if you have a child with behavioral issues or attention, unable to kind of come to the table and sit, so they're running around, you're trying to feed the other kids. And dinner time's hard enough for us, those of us that have multiple kids. I always think the amount of chaos goes up exponentially by the number of children that you have and the ages of them. But so chaotic meal times, and that's hard, and that makes it hard for you to be able to know what are they eating, who finished their peas, and what did the dog eat, who ate enough chicken nuggets, that sort of stuff. So then you get them fed, and then you see these weight changes. And again, we just talked about that decrease in weight and that overweight that can happen. So, and then the nutrient imbalances. So on a practical basis, if your child is just eating those foods, then we need to worry. We might need to add a multiple vitamin while we wait and work towards getting a wider variety of foods in there. So anyway, let's just look at some things that you might have heard of. You might have tried some of these, but they've been proven to be ineffective. So I'm probably aging myself, but there was about 30 years ago, Dr. Feingold And he had the solution. This was even really before there was a good definition of autism and autism spectrum disorders. So he took kids with behavioral challenges or developmental challenges, and he said they need to go on the Feingold diet. So he took all the artificial colors, and again, in the early 70s, the food choices that we had, artificial colors were just being developed. And so I always think I probably ate black and white because there was no glow in the dark macaroni and cheese. There was no bright red spaghetti sauce. There was, so all of this was different. So these artificial sweeteners came on. Dr. Feingold came and he said, all of your child's behavior is related to the artificial colors. And then salicylates. So artificial colors, like red number 40 and yellow, whatever number 5, that sort of stuff. So those are common, and not as common because the market has kind of forced them out. Now you can get plain Cheetos and not glow-in-the-dark Cheetos. But salicylates, so this is the reason this diet was highly disliked by dietitians and physicians. Look at all the foods that are on that list that contain salicylates, just a chemical that's obviously natural in food. Look at all those fruits and vegetables, apples, avocados, blueberries, dates, kiwis, all of those things that are healthy items that you might feed your young child. And then vegetables, all these vegetables, so those all went off the diet. So you weren't left with much. And then you couldn't have cheese and you couldn't have condiments and lots of things. So the diet was so restrictive, but and then you had to follow your kids' diet so tightly that most families gave up. And for the ones that felt like they were successful, as it kind of washed out, it was the fact that the moms were sitting there preparing special foods for their child and sitting there with every meal to make sure they ate all of this and none of that. And so, anyway, so Dr. Feingold, don't do it. It floated back into popularity just barely about 5 years ago, and we all went, oh no, oh no, no. So then, again, and then there's restricted elimination diets. Has any of you been told by your physician that you should give up milk or your child should not have milk? And that's good. That was a big thing a few years ago, the whole dairy industry. Dairy was the cause of acne, stomach aches, behavioral disorders, all sorts of stuff. So people came off of all dairy, had to eliminate all dairy. It's a lot like gluten-free diet now, without cause, without knowing that there is a good effect. So there's gluten-free, casein-free diet. Have you guys heard of that? Same sort of thing. The problem with that, or any of these, is there's not very much food there that a typical kid will eat. So you're looking at gluten-free foods that don't taste the same as regular bread. You're looking at alternative milks that are not as nutritious as cow's milk or soy milk. And so you're limited. And so the problem becomes there's not very many foods. And so even elimination diets, a lot of times a person that might call themselves a health coach or a nutritionist without a medical background will say, let's do an elimination diet and see which one of these foods causes your child's behavior issues. The problem is you have to have a lot of bandwidth in terms of their nutrition, because you're only going to start with things like lamb and white rice and maybe 1 or 2 selected vegetables. Well, if that's not in your kid's repertoire, you're kind of down to nothing. And so then you do that for 2 weeks, see the change in the kid's behavior if they've not wasted away, right, to not eating at all. And then you start adding a few foods at a time. This is horrible, hard to stay with. I guess can you tell I'm not a fan of them. But you look at families in a practical setting. The fact you've got jobs and kids and things, a life to live. And this works in a lab. If I had a kid in a lab that I could eliminate all these foods and just offer him a little bit at a time, it might work. I might sort something out. However, in the real life, it doesn't work. And it's really not shown to be very beneficial. So again, there's my yellow dye. A big thing, it was in the archives of the diseases of childhood. in 2004, they really looked at all those artificial colors and sweeteners, did a double-blind test, and they couldn't find anything. So now let's look at the true ones. Let's look at what's real, or what we know that the science has shown us. So a couple of minerals that seem to affect kids with autism, or there seems to be a correlation. It's not causation, not meaning that this is what caused your child's autism, but some children with autism have low iron levels and zinc levels. And this is different than what they're getting in their diet in general. So they're looking at supplementation, and they're finding that they think there's some improvement in children's behavior and school performance if their iron levels are within the normal ranges and they're not anemic, and also zinc. So zinc and behavior, lots of new stuff out there about adding zinc. Now, the problem is you can add iron, and that's fine. You don't want too much, because iron and zinc and copper all bind at the same place in the cell. So if you get too much iron, then your zinc and your copper drop. Or if you get, if you get too much iron, and then if you get too much zinc, so you say, okay, I know that I'm going to do some more zinc, so I'm going to add a big old zinc supplement. First thing, it's going to give them diarrhea. But second thing, it's going to bind all of the iron spots, and then you can end up anemic. So you've got to balance that. Now, two newer studies that I pulled out looked at high levels of copper. And again, these are experimental studies where they actually pulled blood levels of kids with autism that parents chose to participate in these trials. So too much copper and too much lead. Now, we know about lead. We all know that kids exposed to lead have problems with behavior, have the risk of developmental disabilities. So they're looking at also copper as they started looking at all these tests. So they don't know where the copper, copper is found in minute amounts in almost every food, fruits and vegetables and meat, in the air, in our drinking water, just naturally. It's just part of the environment. So this study that looked at copper and lead could easily identify where kids were getting the lead, usually from their drinking water, like in Detroit, unfortunately, and up in the Midwest. But the copper, they kind of were left with this question about where's the copper? There's just this micro amount. So at the end, they're kind of presuming, or they're going to look at the fact that do kids with autism have something in the way they digest food and retain nutrients that makes them absorb extra copper, or absorb the copper in the environment 100 times better than you and I do. Anyway, I thought it was, as a dietitian, I thought it was a great, interesting study. And looking at treatments, would you increase iron and zinc to pull out that copper? Again, that's not a dietary treatment, that would be a medical treatment. But it was just real interesting to kind of look at that and say, that is interesting. So then, again, over to the vitamin side. Again, we know that vitamin D is essential. As newborns now, the doctors are recommending during pregnancy that the mothers maintain about 1,000 milligrams of vitamin D throughout their pregnancy. Just like adding that folic acid in your prenatal vitamin, they want to add some vitamin D. It helps your baby at birth have adequate vitamin D, which prevents rickets, but also seems to have this relationship to behavior or attention disorders. So related in some ways to the autistic spectrum. So they'll add now, and even if you're breastfeeding, they're going to have you add at 4 months a vitamin D supplement, even if there's not levels to show that. And the B vitamins, and we have always known the B vitamins are related to our brains. So B for brain, those are those vitamins that help with mood disorders, that help with development. So the B vitamins all across that whole spectrum of B1 through B12 through B15, which is a minor micronutrient. So you're looking at that, and so we think that there's some benefit to supplementing vitamins. Again, not really beyond the norm, but if we go back to those kids that are eating 7 white foods or just chicken nuggets and just milk, they're short those B vitamins, because B vitamins come from whole grains, again, from fruits and vegetables, and from nuts and seeds. Those are kind of the big primary sources of that. But if that's not in your kid's diet, then you're a little bit, you might be missing that, and it might not hurt to add that multivitamin. Again, not a single supplement, but a multivitamin that gives you 100% of those B vitamins. If you look on the label of your Flintstone vitamins or even your Polyvisol, that's going to give you what you need over time. I don't recommend going to the store and shopping the B1s and B2s and B6s and B12 because you get too much. And just like iron, copper, and zinc, B vitamins absorb at particular sites in the cell. And if you plugged it all up with B12 or biotin to make your hair grow, then you're going to be short the others. So a good multi. So then let's go back around to things that I think, again, as a dietitian, are very interesting. The role of magnesium. Has anyone ever gone to the doctor for leg cramps, or you've been out being real athletic and you're having these leg cramps and the doctor says, add some magnesium? Or you ever soaked in Epsom salts, which is magnesium sulfate, and it releases your muscle tension, that sort of stuff. So they're looking at the role of magnesium, again, in modifying behavior. And I thought that was another real interesting study, that they were raising the amount of magnesium, not to the point that gives you diarrhea. Again, our bodies have a way of taking care of things, usually through our elimination. So you get too much zinc, there's diarrhea. If you get too much magnesium, you know, milk of magnesia, what is that? That's a laxative. That's going to fix you. So, but adding a little bit of magnesium after you talk it to the doctor, he may evaluate that, she may evaluate that and say, it might not hurt. I mean, here's the research, here's the literature. It's in some of these books too. We'll pass those around. And then omega-3. So omega-3s is my, oops, I lost my omega-3 slide. So omega-3s, what do we know those are? You know where they come? Fish oils. So again, your doctor goes and he checks your cholesterol and he checks your triglycerides and he says 4,000 milligrams of omega-3s. Well, you know, those fish oil capsules are like huge and they taste bad. But they're omega-3s, and the amount that we're recommending is a much, much smaller amount for kids, about 1/4 of a gram, so 250 milligrams are something. I feel very safe in recommending that as an amount that you can add. Again, there's children's chewable omega-3s. There's little packets called Coromega. It's COROMGA, so Coromega. They're like come in little packets like ketchup, and they're kind of orange. They taste like an orange creamsicle. They're very palatable unless your kid is really into those white foods. But it's not as hard to take as a big old pill. But it seems to be excellent. We use it at Scottish Rite for the kids with neurologic problems, and it seems to be helping after you build up a certain level. You know, our brains are about 60% fat, and so if your brother calls you fathead, yeah. So, it changes what the types of fat that your brain is absorbing, and it seems to help. It seems to be beneficial. So, what am I going to do? If I'm seeing you, this is what your doctor, your dietitian, or whoever you talk to about changes in your meal styles or what you feed. Before you recommend any supplementation, you want to look at what they're getting. So as a dietitian, I'm going to ask you a food frequency. How often do they eat vegetables? How often do they drink milk? How many fruits or vegetables do they get a day? So you want to find that out. Then you want to find out about the meal style. How many meals do you miss? That sort of stuff. And then food allergies, medication interactions, you know, are they on some sort of an appetite suppressant? Are they on Risperdal? Are they on something, a seizure med? Sometimes a seizure med or clonidine helps with the behavior management. So you need someone to find out all of that stuff before they start making big recommendations. And so this is one of my disclaimers for the people that want to sell you Dr. Perlmutter's little powdered milk substitute. They're not going to ask you those questions. They're just going to say, ooh, just add this on. And that's what I just want to, if you take home nothing else home, just know that before you buy something like that, you want to find out, you want to talk to someone and find out where the true discrepancies are. So again, there's my multivitamin, and sometimes you need to add a little bit of extra vitamin D. But again, I will know that from talking to you about your diet history, and maybe some iron if we need it. So again, my goal is to work to improve your overall diet rather than adding some extra supplement. Oops. There we go. Oh, I'm sorry, I put my slide in the wrong spot. But again, the children's dose, that should be, that's 2,500 milligrams. That's wrong on that slide. But so it's would be 0.25 grams or 250 milligrams there. I knew I'd see an error in here, right? And then you're looking at, in your fish oils, you're looking at an EPA to a DHA, and those are just two different types of fatty acids. You really wanted a high amount of the EPA, but not so high that you're washing out your DHA. So you'll see supplements sometimes that are DHA supplements entirely. But the EPA, that ratio is just beneficial to you. So again, these are things that you're going to come across that might be beneficial, but you want to go, again, I'm saying go food first. You want to look at food first. So picogenol, who's heard of picogenol? It's from pine, from a particular type of pine bark, but there seems to be some new research out about it. But again, I would talk to your doctor, look at nutrition interactions, that sort of stuff. St. John's wort, I don't recommend. Lots of families like it, lots of adults like it, I don't. And then the ginkgo biloba, I also don't recommend that one either. Just because it has too many nutrient interactions. If you're on, say you're on a seizure med, the ginkgo will come in and decrease the effectiveness of many of the seizure meds. So, you know, you want to watch for this stuff. The Chinese herbs, honestly, I don't know enough about them to recommend them, but there's some new research. So just kind of keep your eye out on the literature, ask your doctor, they might know or they might not. So now, one other thing, probiotics. That is just kind of, again, a newer thing that I'm seeing a lot of benefit to, of adding a probiotic. Now, can I tell you the mechanism in the gut? But you know, the more we know about our gut bacteria, the more we know it affects our brains. So the research is coming out, and again, so the things I feel like I can recommend, a probiotic, a multivitamin, and maybe a little magnesium, but not a lot. And then digestive enzymes. If your child is having a lot of digestive issues, don't just buy them off the internet, but talk to your doctor, see what she thinks, and if possible, maybe add those on in very small amounts. Not like you'll see people take on the internet, or that some people with digestive issues are missing, but a very small amount. But again, the probiotics, any of them, from yogurt with live cultures to, gosh, you can buy kefir drinks. I'm not a fan, but those little kefir drinks, those yogurt drinks, you can buy them in pill form, you can buy them in little sprinkles. But they seem to be beneficial, just in helping with appetite too, and I just wonder if it changes the gut a little bit and kind of makes it more receptive to some foods. So now back to bottom line, very practical, and I probably talked up my time, haven't I? I'm so sorry. I kind of get carried away. So bottom line, you know, we can talk about supplements, we can talk about stuff. Back to the table, back to the table. So structured meals and snacks. So we can't recommend this enough. The hardest thing you'll do, so much easier to buy a little multivitamin, but you want to get them patterned into coming to the table. Now, your little ones may not eat originally at the start. When you start this, I kind of don't expect them to. What you want is them to say, ding, this is the bell, we're coming to the table. I'm going to eat, you don't have to. I'm going to eat, but we're going to stay here till the timer goes off. I have a little chicken timer that I set, and so I will use that a lot when I'm visiting with a family or we're working on an inpatient level. And so you start with not a lot of time, you know, about like a minute per age, because it feels like forever for them. So, so if you're looking at like a 3-year-old that's old enough to understand it's time to come to the table, or even a 1-year-old, a 2-year-old that you want to get in the high chair, you want to do that, you know, you get them involved with the chicken timer or whatever little timer. It's always good, I think, that has a big bell and it's something that you can sit on the table, so that you come to the table and you stay there, and then the bell goes off, then you go away, so that they know that they're not being trapped at the table forever. And again, that's where a minute per year seems to be really helpful. So if they're 10, you're probably going to start with 4 minutes, but the expectation is they would stay at the table until they're until 10 minutes goes off, until the timer goes off. And if you have something that, I've seen timers before that have a big red thing and then it gradually goes out and the red goes away, ding, then it's a visual for them. Those are helpful, but you don't have to buy something special. And then for meals, if you can work towards this, protein at every meal, that seems to be really beneficial. And so what are protein foods? Milk, cheese, eggs, meat of any sort, tuna, something, soy. Tofu is a food to add. I just thought about that. Tofu is a food that I've successfully added to the kids that are eating just white foods. Because if it's firm enough, I mean, the real soft stuff's too mushy. The firmer stuff, cut it in little cubes, maybe fry it up a little bit, and it's just put it on the plate. And it's just there, but it's a marvelous source of protein, and a good source of calcium too. So, so protein at every meal, a whole grain, high fiber. For those kids that have those digestive issues, the high fiber works well. And then go low fat at breakfast if you're getting them to eat. Low fat at breakfast, and then limit simple sugars between meals. So don't let them get away with eating, because they're are not eating at breakfast, and then they'll come to you at 10 and say, feed me, I'm dying of starvation, and you hand them 3 Girl Scout cookies. Well, that's going to defeat your purpose. So you need to have the strength to kind of wear that out, but you don't want them going longer than about 3 hours without eating. So you may need to add a snack after breakfast, or add a snack in that mid-afternoon for all ages. You know how for toddlers we say feed them every 3 hours, but even as teenagers up to 15, 16, don't let them go a long time without eating, because then it becomes unreasonable. It feels unreasonable for them. And so I gave you this because I got permission from Autism Speaks to make copies for you all, and so I think that we got copies. Thank you for making those copies. But it's just a great suggestion, practical suggestion from other parents that have lived a life, and it gives you some suggestions, not only about underweight kids and poorly eating kids, and they all the way to overweight kids. So again, so here's my other advice about dietary interventions: family meals. And I know that's hard to do. The family meals at least 3 to 4 times a week really helps with that behavior. So you come to the table, you turn off your cell phone, there's no music, there's no other sensory input. In fact, I recommend turning off the other lights in the house, so that the only place that's really lit is the dining area where you're eating. And then, so then it's a low stress, so you can't fuss at them while you're eating. You put the food there, you make it a pleasant environment. If they're not going to eat, talk about anything else but eating. Not eat your green beans, not drink your milk. You say, how was your day? Here's a joke about a cow. Here's, something, so that you're taking the pressure off, because otherwise you'll set up this relationship, this feeding relationship, where they're not going to eat because you've said to eat. So you change that environment, and I've seen this work wonders with all sorts of kids. So you drop that stress, you drop that fuss, you worry about the nutrition later, because you know that you're going to get there. You're going to get there. So, and here's another thing for kids on the spectrum. A lot of times they get attached to a cup or a plate or a fork or something. Honor that. Honor that, because you're working on feeding, you're working on nutrition, not so much getting them to love every color of plate in the spectrum. So, so honor that, because then they can focus on the food, because very often, I mean, you've ever had a toddler that says, this is the wrong cup? Well, sometimes they get caught like that. I find it particularly with kids on the Asperger's spectrum. You know, they're pretty aware of their environment, but they're very into structure. It's got to be this, it's got to be this, it's got to be this. And then serve familiar foods with unfamiliar foods. So if you're going to add vegetables, say you're adding carrots, it takes 10 exposures to carrots. And I only see a couple of dads here, or 3 dads here. So I always think kids eat what dads eat. So dad, pick out those vegetables that you like and work on them. So you put them on the table, you put them in a little cup out of their space. You start out of their space, and then it's always there. Even if you're using the same can of green beans and you're putting green beans there or sliced carrots, just a few out of in their line of sight at the table, and then each time you move them closer. So they're kind of attenuated, or they're kind of used to that. Then it gets on their plate, or then it gets on their placemat, or then it gets closer to their plate. One of these days, you're going to have one of those carrots on their plate. But truly, truly it works, because it becomes a familiar thing to them. If you just plank a bunch of carrots on the plate and they've never seen them before, you might as well put worms on there, or crickets. You know, it's just not a familiar food to them. It's not something they're going to trust. So at any rate, so familiar foods, two familiar foods, 1 unfamiliar food, and that helps you get that, again, kind of coming from that book of food chaining. So anyway, again, truly, I've talked myself way past my hour, but thank you for your time.